Good morning, my name is Francesco Caprioglio. I'm head of Cath Lab in Dell'Angelo Hospital in Mestre, Venice, Italy. I present two clinical cases from our series in which I believe particularly useful functional assessment of coronary stenosis. Here you can see my disclosures. The first case is about a 76-year-old gentleman, current smoker, dyslipidemic, and with type 2 diabetes. He was admitted in the local medical department because of an initial heart failure. His past medical history was not relevant. He was on aspirin 100 mg, glibenclamide 2.5 mg, plus metformin 400 mg and lansoprazole 30 mg. An echocardiogram showed infralateral hypokinesia of the left ventricle and a low ejection fraction of 35%. On the basis of a presence of multiple risk factors, heart failure and depressed pump function with regional abnormal valve motion, we thought to perform coronary angiogram. As you can see, coronary angiography showed a very diffuse disease with functional occlusion of right coronary, ostial moderate left main stenosis, ostial moderate and multiple severe stenosis at the second and distal part of LAD, double significant lesion of obtuse marginal branch. We discussed the case with surgeons, but it was refused because of distal involvement of LAD and circumflex, and consequent poor indication for CABG. So the case was scheduled for multivessel PTCA with DES. We performed RCA stenting with DES in the first, second and third segment. Then kissing balloon on PD-PL with acceptable final result. Here you can see in two different views how diffused was the disease of the left coronary, and another view of obtuse marginal. The left coronary artery was interrogated with pressure wire, as you can see in the picture, with the purpose to place stents only in the functional significant stenosis. We used iFR that is available in our cath lab. iFR was 0.96 in proximal LAD, 0.83 in the mid portion, and 0.80 in the distal part. Guided by iFR assessment, we stented the mid portion of LAD with DES. Then we evaluate the effect of PCI. The iFR values predicted the effect of our intervention. We decided to leave the distal part of LAD without treatment, considering the distality and the extension of the disease. We evaluate also obtuse marginal. Value was 0.84. We decided to place 2 DES. This is final angiographic and functional results. In the presence of a very diffuse disease, functional guided PCI is a good tool to avoid useless, unnecessary stents with a significant functional improvement.